The member for Higgins.
Thank you, Madam Deputy Speaker. And I rise to support the member for Grey's motion about diabetes because this is such an important area. It affects so many millions of Australians. And I just want to start my remarks by commenting on the fact that the Australian of the Year this year is Dr James Mukey AM. And James has decided to make prevention of diabetes one of his main topics because it is such an important area with regards to his background. He's an ophthalmologist by training and cares deeply about how to save people's vision. And we know that diabetes is one of the leading causes of blindness. So it is wonderful to hear that an Australian of the Year this year, Dr James Mukey, is championing the issues with regards to how we can prevent diabetes and save people's sight. James actually is someone that I've worked with many, many years ago, and it's great to see him being elevated to this position of Australian of the Year. I worked with him in Kenya 30 years ago in Tumu, and he's a very dedicated and passionate medical researcher and clinician who really has brought a great deal of passion to this area. And I will say that unfortunately for James, in the period of the pandemic, it has been more difficult for him to actually amplify his message. So I'm delighted to stand here with the other members in this chamber to amplify what is really a very, very important issue, and that is the issue of diabetes. Now, the public sometimes can conflate the issues of diabetes into one, but effectively diabetes is three conditions in one. The first is type 1 diabetes, the second is type 2 diabetes, and the third is gestational diabetes. So type 1 diabetes is in my field of paediatrics. It occurs in young children. And we don't know why type 1 diabetes occurs, but basically something attacks the pancreas and the pancreas can no longer produce insulin. So type 1 diabetes is actually a very, very frightening condition because it has a sudden onset where children will start to drink massive amounts of water and urinate very, very frequently. We're talking about 3 or 4 litres of water in a day and are going to the loo in enormous amounts. They can become quite distressed and lose their sense of self about themselves, and it becomes an emergency. And they can become so sick that they're rushed to hospital. So type 1 diabetes can be really a terrible, terrible emergency, resulting in ketosis and quite significant risk to the child. And in fact, one of my staff members has a child with type 1 diabetes, and we see every day in our office how she has to live with juggling being a professional woman and having a family at home, including a child with type 1 diabetes, and how to normalise his life. He has to take insulin every day, and there are periods when he becomes sick and his diabetes requirements change, his insulin requirements change, and that has a great impact on her ability to be able to juggle her work-life balance. And I know that Sue Liedler is a wonderful supporter of mine, and I'd like to name and honour her in this chamber because she's someone who's living the life of having a child with diabetes. And it is a life that is a difficult life for her, but she does it lovingly and supportingly for her son so that he could have a life that is not a child who has diabetes, but a child who has a wonderful and fulfilled life. But type 2 diabetes is a completely different kettle of fish, and that is a condition that is later in onset where over a long period of time people become resistant to insulin because they develop antibodies. And we do know that there are lifestyle factors that contribute to the development of diabetes, and that is rising in prevalence because of problems such as obesity, high sugary diets, and poor exercise. So diabetes type 2 is something that we can all do to change our lives. Keep fit, lower your sugar intake, and make sure that you get out there and try and keep healthy and fit, because that is actually keeping your weight down is a great way to manage type 2 diabetes. And if you develop type 2 diabetes, losing weight is one of the first steps to managing that. So what I would say is, at a political level, it's been incredibly important to have the Australian National Diabetes Strategy, which was released in 2015 and is due for an update. And I would encourage our government to make sure that we include in this refresh the prevention strategy. And I know that is in the works, but this is because prevention, of course, is better than cure. And as a paediatrician, I know that, but I think the taxpayer also knows that. If we prevent cases of diabetes, we don't have to deal with the economic and health burden that diabetes creates in our community. So it is very, very important that instead of having the ambulance at the bottom of the cliff where patients fall down and the medical system is at the bottom of the cliff, that we put it at the top of the cliff and prevent people from going off that cliff in the first instance. So I'd really recommend the fact that the federal government is refreshing its national diabetes strategy and that is going to help our Indigenous population as well. Thank you, Mr Deputy Speaker.